not to date myself, I'm getting old and gray-headed now, but I finished my medical training and started in medical practice in earnest in 1998. And at that time, we were basically relegated to weight loss medications that were amphetamine driven. And everyone's heard of amphetamines, just like the illegally used amphetamines. They amp up your system, they make you jittery, all of these things. They burn energy. And the medical treatment, other than some side B12 injections that we would use, that we were trained. Even in 1998, I was trained that was basically the only thing we had for weight loss. And of course, people lost weight because they were on legalized speed. They were on amphetamine. So they're walking around, at 10 times the rate. But even then, they were still hungry. And the tragic thing is when we stopped the medication because of that, they gained it back quickly, and sometimes even more with a vengeance. And we were also very concerned. I was always very, very concerned about the cardiac effects of amphetamines, because their resting heart rate would go from what it should be in the low 80s or high 70s average up to, approaching, the resting heart rate needs to be controlled, and the amphetamines raise those. So there were a lot of risk that came out from those. When you compare that, and shockingly, you advance that from 1998, 20 years later to present day, that has still been, the majority of physicians out in the general public are using those amphetamine-based weight loss medications. That just don't work. Then you go through to starvation diet. I've studied every diet on the planet, the Okinawan diet, the paleo diet, keto diets, all those things. And granted, we need to reduce our carbohydrate intake. We need to stabilize our protein intake. Carbohydrates really do cause a lot of weight gain. But this medicine stands out. It is so profound in the fact that the patient takes it and they don't feel hunger. The number one thing that causes people to fall off the wagon with weight loss is they're hungry. You're fighting a natural urge to eat. You're having to order a nice big steak at a steakhouse and push yourself away from it. Not this medication. You can't out-eat this medication. When you order that steak now on what we're using now, the profoundness of this medicine is you're going to take 2 bites of that steak and you're going to take the rest of it home to your dog. He's going to eat pretty good, right? So that's how profound it's weight loss. It modifies your eating habits and your lifestyle, and after a while, these patients get used to. They learn portion control because they're just not hungry. There's nothing worse than fighting hunger and satiety, right? We've been there. And that's what makes it profound. And that's why I'm saying, you realize I've got patients who had a gastric bypass surgery 15 years ago, gained the weight back, and they're on this now, and they're losing more weight. Documented. They've lost more weight on this medicine than they lost from gastric bypass surgery. Now that's profound.